Hi, my name is Pat Payne with SKY Rehab Hospital. From time to time, we have family members who will call in asking what qualifies a patient for inpatient rehab, whether it's respiratory therapy, occupational therapy, physical therapy, or speech needs. We have great clinical liaisons out in the field at our local hospitals as well as in the local community. I want to introduce Tami Crane, who's a clinical liaison, who's going to walk through the process of admissions for us here at SKY. Tami?
If you're at home and you feel you're having an overall decline in your health or functional mobility or an increase in falls or confusion, you would notify your primary care physician for an order for an evaluation for possible inpatient rehab at SKY Rehab Hospital. If you're in one of the local hospitals, you would just notify your care coordinator or discharge planner that you would like to do inpatient rehab at SKY Rehab Hospital. Once the orders are received from home or from the hospital, then your insurance will be verified. Once your insurance is verified, then you will be presented to our medical director for acceptance to SKY Rehab Hospital. Your best chance for success is at SKY Rehab Hospital.